Malaria affects much of the world's population. In 2010, an estimated 655,000 people died because of malaria. Although many people are affected, certain groups are more prone to malaria infection. Children, pregnant women, and people affected with HIV/AIDS are all at risk for more serious infections. Children are very vulnerable to malaria, and it is a big problem because 40% of the children in the world are at risk to be infected.
Malaria is an infectious disease caused by a single parasite of the genus Plasmodium. This parasite is carried by female mosquitoes known as Anopheles gambia.
The symptoms of malaria include fever, chills, fatigue, an enlarged liver, an enlarged spleen, anemia, seizures, coma, and kidney failure. These symptoms can cause working people to stay home and take care of themselves and their families, causing them to sacrifice their income.
A mosquito becomes infected with Plasmodium when it sucks the blood of an already infected person. When the mosquito bites another person, it injects the Plasmodium into their bloodstream. After the Plasmodium is injected, it travels through the bloodstream to the liver and affects the liver cells. The Plasmodium then travels back into the bloodstream from the liver, invading red blood cells and reproduces. The red blood cells then are ruptured, causing a wave of symptoms of malaria. Then the Plasmodium infects more red blood cells, repeating the process.
The reason that children die quickly is because of the anemia that comes along with the infection. This is made worse because if they are born to mothers that are already infected with malaria, their low birth weight can affect their chances of survival in the first years of their lives.
The most effective way to help save these children and their families from malaria infection is the distribution of insecticide-treated malaria nets. Nets that hang above beds at night prevent mosquitoes from infecting a person the entire time they sleep. Because the nets are treated, they kill mosquitoes that make contact with it and prevent mosquitoes from coming near the area around the net. This means fewer mosquitoes entering the house. Research from the Nets for Life Foundation shows that the mosquito population can drop by almost 90% when most of the community uses the nets consistently.
Nets can help whole communities, not just the people using them. Many types of malaria can affect people's whole lives. The price of medicine can put people in serious poverty and affect them for the rest of their lives. Every minute, a child dies from malaria in Africa. 98% of deaths from malaria in the whole world can be placed in 30 countries in sub-Saharan Africa and 5 countries in Asia. With the nets we distribute in sub-Saharan Africa, we can save many children's lives. If we were to buy just the nets at $3.50, we could buy 2.85 million nets. If we were to also factor in the cost of distribution, education on how to prevent malaria, and retreatment in the future, that would cost $10 per net. We are using $10 million to buy 1 million nets, educate, and retreat the nets.